Hi guys, it's me Laika Sobrivilia, and today we are going to tackle the things about physical and chemical injuries. We are going to spend most of the class reading or discovering on the topics about physical and chemical injuries. In each topic, we will add features to this while we learn. I hope you guys can learn something at the end of this report. So let me introduce you guys, my fellow reporters, Bag and Fitzodri, Corpus Nerissa, Sobrepenia Mitus, and Sobrivilia Laika. That's me.
Hey, this is Mita Sabrapenya and I'm going to discuss the first division of the physical agent, which is the physical influences. Physical influences have four subtopics which can be seen on the screen. So to further understand these physical influences, let us now jump on the mechanical trauma. Mechanical trauma is the first type of physical influences wherein it includes the following. Before we're going to tackle about the subtypes or subtopics under mechanical trauma, let us first elaborate what mechanical trauma is. Mechanical trauma is due to blunt force injury, sharp force injury, gunshot wounds, strangulation, and/or injuries due to heat and coldness. But take note, these do not necessarily appear immediately after occurrence of the injury. That's why all the significant mechanical injuries must be kept under observation for days or even weeks. If you are somehow confused with the difference between the blunt and sharp force injury, then let's differentiate it. When we say blunt force injury, this could be done by the use of firearm groups such as pistol, rifle, submachine gun, etc. And even the non-firearm group such as baseball bats, in which it can produce lacerations. And if what is laceration, we will tackle it later on. Whereas in sharp force injury, this includes the use of knives, axes, swords, and many sharp objects which produce incisions. So to further understand mechanical trauma, let's now proceed to its patterns of injury. First, we have abrasion. If we're going to take a look in the picture or illustration that was given in this slide, you can see a dog's foot wherein the skin has been worn off due to a superficial rub. Abrasions are not usually that serious, or these are usually minor injuries that can be treated at home. So, the skin may bleed or drain small amounts at the time of the injury or at times over the next few days if rubbed or scratched. So, that is what we call abrasion. All in all, abrasion is the wearing away of the upper layer of the skin caused by a scrape or a brush burn. So here, just take a look at the picture and you will already have an idea on what abrasion is. Next one, we have contusion. Contusion happens when small blood vessels get torn and leak blood under the skin. So if we're going to take a look in the illustration provided, we could think of it as a bruise with a black and blue spot. By the way, contusion is the medical term for bruise. Another is that contusion is the result of a direct blow or an impact such as a fall. This could also be done through blunt objects such as hammer, baseball bats, or anything without sharp edges or point. Next, we have laceration. Laceration is produced by the tearing of soft body tissue. As you can see the image provided, you can see a missing part of the dog's hips or body, which is termed as laceration. Laceration is somehow similar to the word cut, but the only difference between them is that cut is usually minor, whereas laceration is often serious. Unlike in contusion, none of the skin is missing, while in laceration, it has. Like for example, when a dog was bitten using a baseball bat, this is just an example, okay? In contusion, it doesn't create any cut. Instead, it will cause a blood clotting. Whereas in laceration, it may cause a skin tear or cut caused by a blunt object, which is the baseball bat. So that is how laceration works, or that is how laceration is. Next, we have the incised wound. Incised wounds are caused by sharp objects such as shards of glass or knives slicing into the skin. So this is an example of an incised wound. As you can see, the wound is narrow and clean, but long. Even if incised wound only have a narrow wound, it is still considered as somewhat serious because it tends to bleed heavily as multiple vessels may cut directly across. So that is how incised wound is. Next, we have puncture wound. Puncture wound is a forceful injury caused by a sharp, pointed object that penetrates the skin. Nails, tacks, ice picks, knives, teeth, and needles are some of the objects that might cause puncture wounds. A puncture wound is usually narrower and deeper than a cut or a scrape, but even if that's so, it can still increase the risk of infection, for it is hard to clean. Puncture wound comes into two divisions or classifications. It is called penetrating puncture wound if an object penetrates the tissue, while it is called perforating when an object passes through a tissue which also creates an exit wound. For example, when a foot has been pierced by a nail and it creates an open wound, this is classified as penetrating puncture wound. Whereas if a foot has been pierced by a nail and it passes through the foot or the back of your foot, it is now classified as perforating puncture wound. So that is puncture wound. Next is the rupture wound. When we say rupture, it is similar to the word burst, which causes the skin to stretch. Rupture wound usually occurs when a surgical incision reopens, either internally or externally. There are wound cases that during the time of healing or during the period of healing, the wound itself will rupture, which causes the tissue or even the skin to stretch. As you can see the illustration or picture on the slide, you can see an example of a rupture wound wherein the dog's skin were stretched. So that's how it is. Alright, next we have fracture. When we say fracture, it is a partial or complete break in the bone, cartilage, tooth, hoof, horn, or claw. Fractures are often caused by falls, bump, injury, or because of a direct kick to the body. Based on the illustration, some types of fractures were given and illustrated, and by merely looking at the sample photo, you may now have an idea on what fractures are. Okay, another type of mechanical trauma is the concussion. Take note, concussion is different from contusion that has been discussed earlier. Concussion has something to do with the central nervous system, which is associated with the loss of consciousness. Concussion is a type of traumatic brain injury or TBI which is caused by a bump, blow, or jolt to the head or by the hit to the body that causes the head or brain to move rapidly back and forth. So here's an image which shows a dog suffering from a concussion. As you can see, the dog was like unconscious and at the same time it seems like it doesn't have any desire to act. It was pitiful and I hope he gets better as soon as he can. Okay, let's move on to the next slide. We have here the sprain or strain. The difference between a sprain and a strain is that when we say sprain, it injures the bands of tissues that connect two bones together, while a strain involves an injury to a muscle or to the band of tissue that attaches a muscle to a bone. By simply looking at the pictures provided, you can now identify what is a sprain and what is a strain. Lastly, we have the luxation or dislocation. Basing on the illustration, here we can further understand what dislocation or luxation is. So we have here an image of a dog suffering from a patellar luxation. So at the left side, we have the healthy dog knee, wherein the patella were at the right position. But in the unhealthy dog knee, we can observe that the patella move on the other side. So, the dislocation of the dog's patella is an example of dislocation or luxation. Well, These are all the mechanical traumas, patterns of injuries, and I hope you've learned and understand what are their differences, and at the same time, I hope you can now define mechanical trauma on your own. The second type of the physical influences that we're going to tackle is that the injuries due to pressure. A pressure injury happens when force is applied on the surface of the skin. This force can be a constant pressure on an area of skin or a dragging force between the skin and another surface. These injuries usually happen over bony parts of the body such as hips, heels, tailbone, elbows, head, and ankles. So, how these pressure injuries happen and acquired? Well, the pressure that causes injury can come from lying in bed, sitting in a chair or wheelchair, or wearing a cast for a long time. These injuries often occur when patients have limited mobility and can change positions in bed on their own. Due to the pressure on a particular part of the body, the flow of blood supply on the affected area may disturb. That's why injuries due to pressure occurs. As you can see on the illustration provided, the dog is suffering from a pressure injury, wherein part of his hips had become darker. So that is how pressure injury looks like. The third type of physical influences is the injuries due to obstruction. If we say obstruction, it is similar to an obstacle or barrier. So let's take a look at the picture given in this slide. It is a photo of a dog which seems like stool stuck into his colon or rectum. This is an example of an intestinal obstruction wherein something is blocking in the intestine. Food in his stool may not be able to move freely. When the intestine works normally, digested food moves from the stomach to the rectum, and along the way, body breaks food down into usable parts and turns the rest into feces or stool. And if there's something that's blocking into the intestine, then that is what we call the intestinal obstruction, similar to the photo given in this slide. And this phenomena is classified as injuries due to obstruction. And the last type of physical influences is the injuries due to malposition. So here, we can see the types of injuries due to malposition. But before we're going to jump on these types, let's first define what is malposition. If we say malposition, then we can have an idea that it is something that is displaced. And if we say injuries due to malposition, then these are the organs or parts of the body that has been displaced through physical influences. So, here we have a trivia, okay? Just read it on your own. Okay. Alright, let's proceed to the subtypes of malposition, beginning with the volvulus. From the given illustration, we can see a dog having a normal or healthy intestine and body. The second one is bloated and its intestine starts to grow bigger. Whereas the last one, the dog's intestine became bigger, much bloated and twisted. At the same time, the dog also became unhealthy and inactive. This illustration just explains what a volvulus is. For clearer understanding, volvulus is a twisting of the intestine upon itself that causes obstruction. Next, we have torsion. Torsion usually occurs in the intestine of cow or horse. So, torsion is the twisting of an organ. From the root word twisting, we can now have an idea on what torsion is. Based on the given illustration, we can see the difference between the normal uterus from the twisted one. So, the twisting of uterus explains how is torsion all about. Another type of malposition is intussusception. Intussusception is a rare and serious disorder in which one part of the intestine slides inside an adjacent part. Based from the illustration, that is how intussusception looks like. Next, we have the prolapse. The given image is an example of vaginal prolapse wherein the tissue of the internal vaginal walls swells and protrudes through the vulva. So, when an organ sag or droop out of their normal position, then it is termed as prolapse. Prolapse can either be small or bigger. If prolapse is small, it is called as incomplete prolapse wherein it just have a little movement. And it is called complete prolapse when it is bigger. A complete prolapse is the one where the organ has shifted significantly out of its normal place. Next is the eversion. Our sample illustration is a photo of a dog suffering from an eversion. In cats and dogs, they have what we call third eyelid, wherein it serves as their eye protection. But if why does their third eyelid protrudes, become bigger and pinkish, this is due to an infection, tumor, wound, allergy, or whatever that may cause harmful effect on their eyes, particularly in their third eyelid. And the protrusion of the cat's or dog's third eyelid, that is what do we call as eversion. Next is the eventration. Eventration is a condition in which all or part of the diaphragm is largely composed of fibrous tissue with only few or no interspersed muscle fibers. Just take a look at the image provided. That is how eventration looks like, particularly a diaphragm eventration. So why does diaphragm eventration happen? Well, the diaphragm is supplied by an important nerve called the phrenic nerve. If this nerve is injured, the diaphragm can shift upward and the muscle replaced with fibroelastic stiff tissue over time. So, that is how eventration occurs. Lastly, we have the hernia. Hernia occurs when an organ pushes through an opening or weak spot. Sometimes the muscle weakness is present at birth. More often, it occurs later in life. So, hernias are by a combination of pressure and an opening or weakness of muscle or fascia. Basing from the illustration provided, the dog is suffering from an umbilical hernia. An umbilical hernia in dogs is a condition which creates a noticeable squishy protrusion under the dog's stomach. This condition resulted from the incomplete closure of the umbilical ring when the dog was given birth. Sometimes it can be cured alone, but in other cases, operation is needed. So, without further ado, these are all for the injuries due to malposition.
Hi guys, it's me Laika Sobrevilla and I will do the continuation of this report. So we have here thermal injury. When we hear thermal, we think about of high intensity of heat. So what is thermal injury really? Both excess heat and excess cold are important causes of injury. Under thermal injury, we have excess heat. Heat produces varying degrees of injury depending on its intensity and duration and the percentage of total body surface involved. So it talks about intensity, which means how hot it is. And so there are two types of it. We have thermal burn and heat stroke. Thermal burn, a lesion produced from excessive application of heat. Two types of burn we have here: surface burns and inhalation burn injuries, or internal thermal injury. Surface burns, any burn exceeding 50% of the body total body surface, whether superficial or deep, is grave, and when it exceeds 70%, very often fatal. So in surface burns, we have here full thickness burn and partial thickness burn. So under full thickness burn, it involves total destruction of the entire skin with loss of the dermal appendages. So can we recall what are the layers of the skin? So starting from the epidermis, we have stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, stratum basal, and of course the dermis. So it says here, destruction of the entire skin with loss of the dermal appendages. So what are the dermal appendages? So we have here the appendages of the skin are hair follicles, sweat auricular, apocrine, and sebaceous glands. In full thickness burn, as a result, no epithelial regeneration can occur except from the margin. The full thickness burn may extend deep into the underlying muscles, viscera, and even bone. But with such penetration, death is often immediate. Both Third and fourth degree burns are in this category. Next, we have here partial thickness burn. At least the deeper portions of the dermal appendages are spared. So when we compare full thickness burn from partial thickness burn, full thickness burn is more lethal than the partial thickness burn. Well, partial just imply a low intensity of heat and include first degree burns epithelial involvement only, and second degree burns involving both epidermis and superficial dermis. The area becomes reddened as small blood vessels dilate. The next thing we have here, inhalation burn injuries, producing pulmonary edema and bronchopneumonia from secondary infection. Okay, so this kind of injury are actually done to the animals trapped in a burning building, who inhale heated air and noxious gases in the smoke, may develop inhalation injury at any level of the respiratory tract, from nose and mouth to the lungs. Water-soluble gases such as chlorine, sulfur oxides, and ammonia may react with water to form acids or alkalis, particularly in the upper airways, and thus produce inflammation and swelling, which may lead to partial or complete airway obstruction. Pulmonary edema is a condition caused by excess fluid in the lungs. So as we can see in the picture, the cat is like really devastated, like you can see that it is sick. Yeah, that's the most basic explanation for this picture. And next, this is a model of a recovery. A model of recovery from inhalation injury and cutaneous burn in ambulatory swine. Okay, so that picture is a bronchoscopic images over 2 weeks after injury. And the letter A, as you can see, the letter A right there, views of the main airways, with top row showing the trachea at the level of the carina, and while B, the bottom row, depicts airways at the level of the accessory lobe. Both locations are significantly erythematous immediately after injury and out to 2 days after injury. However, the upper airways recover and appear to have returned to baseline conditions. Okay, so that's about the picture. And again, grading of burns. We are already aware of this, but we will be discussing it again. So we have first degree burn, second degree burn, third degree burn, and of course, fourth degree burn. Under first degree burn, reddening of the skin due to hyperemia and erythema and mild inflammatory reaction. So this is followed later by a slight peeling of the superficial layers of the skin. So in the picture, it was just reddened. Okay, it's not that very lethal, but just a simple reddening of the skin. Next thing we have here, second degree burn, characterized by the blister formation or vesicle. The epidermis appears coagulated or coagulative necrosis, and there is also inflammation. There is much destruction of epidermis, but living cells around and beneath it regenerate and fill the gap, so that complete recovery soon occurs. So have you noticed that when you got burned, it forms a bumping skin, and it is reddish, and later on some water will appear inside it? Well, we call that blister. Okay, that's a blister. Next, third degree burn, complete necrosis and severe inflammation. The dead tissue sloughs, leaving an ulcer that heals slowly by granulation tissue formation. It later shrinks and leaves a scar. I remembered when we were still young, my sister accidentally pulled the mango that was just cooked and was really hot. And so they rushed her to the hospital, and luckily there was someone who got a baby, and then they used the placenta to cover all the burns in the body of my sister. Well, the placenta is really that helpful, and it made her recover well and made her skin felt better. And And why is that possible? Well, the innermost layer of the placenta, known as the amnion, is made up of special cells that stimulate the body's healing mechanism. So it tells the cells of the body to work well, to work faster. And so that's it. So let's tackle the fourth degree burn. The tissue is completely charred and blackened. So in fourth degree burn, mostly of the, almost, or yeah, it's actually most of the cell layers are affected, as you can see in the picture. And this is very, very deadly. If burns are extensive, involving 1/4 to 1/3 of the body surface, and even if only a first or second degree burn is present, death occurs within 24 hours, and in most severe burns, even within an hour, the animal shows difficult respiration, fall in blood pressure, and body temperature. Okay, so this is very lethal. And so we have here heat stroke, associated with high ambient surrounding temperatures and high humidity. It talks about how hot the weather is, how hot your surrounding is, how sultry it is. So an example of this is when my uncle gave a bath to his Shih Tzu, and then later on put the Shih Tzu under the sun to make it dry. After some quiet minutes, the dog died. Why? Because it was so hot back then. It was summer. So what do you expect? The dog died with heat stroke. And next we have here excess cold. The effects of hypothermia, prolonged exposure to low ambient temperature depend on whether there is a whole body exposure or exposure only of parts. So just like excess heat, excess cold is actually lethal too. And under excess cold, we have here local effects and systemic effects. Okay. Oh, so wait, before we continue, there is something I want to talk about heat stroke. Okay, heat stroke occurs when the thermoregulatory mechanisms fail, sweating ceases, and the core body temperature rises. The early symptoms are dullness and depression. So let's proceed to local effects. The local effects of low temperatures vary according to the duration and degree of cold. Chilling or freezing of cells and tissues causes injury in two ways. Okay, so let's proceed, and we have here a commercial, just like a simple commercial. Pig hearts have been used in human heart transplants. So how could this be possible? Well, the heart of the pigs are the same with the human heart, so further research about this topic is still ongoing, and so let's proceed. Direct effects. Upon freezing, water within the cell and outside undergoes crystallization. So in English we call that water, and in Ilocano, in our place, we call that water. Okay. Upon freezing, water within the cell and outside undergoes crystallization. And next we have here indirect effects. There is vasoconstriction and increased vascular permeability, causing edematous changes, atrophy, and fibrosis may follow. Systemic effects. Cooling of the peripheral blood soon causes depression of the body temperature in the vital organs with slowing metabolic processes, particularly in the brain. So excess cold may affect the brain, and also hypothermia is dangerous. When exposed to cold temperatures, your body begins to lose heat faster, and it produces lengthy exposures will eventually use up your body's stored energy, which leads to lower body temperature. Another thing we have in excess cold. Okay, excess cold. Death may result when the whole body is exposed without causing necrosis of cells or tissues. This is because the systemic homeostatic mechanisms are more vulnerable to hypothermia than are individual cells.
The third division of the physical agent is the injuries due to light. Here we can see the word photosensitization. Photosensitization is applicable for animals. If we humans exposed to the ultraviolet rays coming from the sun and it causes some skin irritation or allergy, then we called it as sunburn. But in animals, they do not suffer from sunburn. Instead of sunburn, they called it as photosensitization or light sickness. So why does sunburn is not applicable in animals? Well, we all know that animals are covered with hairs, wools, or feathers that protects them from the sun's rays. But if they show an unusual reaction, then that's the time that the word photosensitization will become present. So to further understand this, let's now proceed to the next slide. So it says here that within our skin or in animal skin, there is what we call photodynamic pigment that is present. And these photodynamic pigments causes the skin to become more sensitive and irritated, particularly in sun's rays or in sunlight. That's why an unusual skin changes may occur as photodynamic pigment absorbs sunlight, and these changes is called as photosensitization. So here are some of the examples of animal images suffering from photosensitization or light sickness. As you can see, the changes in their skin has been emphasized. The removal of their wools and hairs were shown, as well as the effect to their image can be seen, and by merely looking on how the images provided us the idea on what photosensitization looks like, then we could really think that there's something wrong with their skin. Okay, here photosensitization are divided into three parts or types. So let's now start to explore their significance and differences. Beginning with the primary photosensitization. Okay, we have mentioned earlier that photodynamic pigments are present in the skin. But here, at the primary photosensitization, these photodynamic pigments are also present in some plants. So when animals have eaten these plants containing photodynamic pigments and exposed to the sun rays, then that's the time that animals, particularly domestic animals, might show an unusual changes within their skin, or they could even have the skin cell membrane damage. Within the 4 days or 4 to 5 days staying into the pasture, domestic animals such as carabaos, cows, goats, sheep, pigs, and horses may already acquire this phenomenon, which is called the photosensitization. Next, we have the photosensitization from abnormal porphyrin metabolism, which is the second type of photosensitization. Here, we have the two types of porphyrins, which are the uroporphyrin and the coproporphyrin. Uroporphyrin causes discoloration of the bone, which is known as the osteohemochromatosis, and the discoloration of teeth, which is called as pink teeth. Porphyrins produces the heme, which is responsible for binding oxygen. So, these porphyrins are important in hemoglobin as well as in the body. But, if the production of these two porphyrins were exceeded, then it will become photodynamic, which can lead to congenital porphyria. And if what and how congenital porphyria is, let's now proceed to the next slide. So these are some photos of animals suffering from congenital porphyria. So as you can see, it usually occurs in the animal's teeth. So overall, this kind of animal problems are done through the abnormal porphyrin metabolism. Next, we have the last type of photosensitization, which is the hepatogenous hepatotoxic photosensitization. Hepatogenous photosensitization occurs when the liver cannot conjugate phenylephrine, a porphyrin derivative produced by microbial degradation of chlorophyll in the gut, causing it to accumulate in the bloodstream and tissues. In the superficial layers of the skin, phenylephrine absorbs ultraviolet radiation of the sun. Energy from the activated phenylephrine molecule is then transferred to adjacent cells, causing chronic inflammation and necrosis. So, phenylephrine is considered as photodynamic That's why if these were not excreted, especially if an animal has a hepatic dysfunction in lungs or bile duct lesion, it will boost the amount of circulation which leads to the absorption of the phyloerythrin itself. If this happens, this will be called as the hepatogenous or hepatotoxic photosensitization. And because of this, it might also lead to the inherited hepatic defects, biliary obstruction, leptospirosis, and chemical poisoning. So, here are the sample photos of animals suffering from a hepatogenous or hepatotoxic photosensitization. So, these are all for the injuries due to light, and I hope that you have understood the things that comprises the photosensitization, which will give rise to the idea of the injuries due to light.
And next thing, we have here injury produced by ionizing radiation. We have here electromagnetic waves, specifically X-rays and gamma rays, and B, high-energy neutrons and charged particles, alpha and beta particles, and photons. So before we continue, how does radiation affect animals? Ionizing radiation can affect the atoms in the living cells, so it poses a health risk by damaging tissue and DNA in genes. Ionizing radiation comes from X-ray machines, cosmic particles from outer space, and radioactive elements. Radioactive elements emit ionizing radiation as their atoms undergo radioactive decay. Injury produced by ionizing radiation. Ionizing radiation occurs when atoms have one or more electrons ejected owing to interactions with electromagnetic X-rays and gamma rays, or with high-energy neutrons and change particles, alpha particles, beta particles, and photons. B. When ionizing radiation strikes an animal cell, it can break chemical bonds inside molecules or form new bonds. And the last one is that it may directly damage DNA, directly radiation, or via free radicals. So it was discussed a while back. And animal cells that divide rapidly suffer the most serious damage during acute exposure. Cells in bone marrow and lymphatic tissue, for example, are especially vulnerable, as are the fast dividing cells in the lining of the mammalian gastrointestinal tract. Massive doses of radiation can cause diarrhea, vomiting, internal bleeding, anemia, exhaustion, permanent sterilization, and of course death. And so we have here a commercial. Sheep are known to self-medicate when they have some illnesses. They will eat specific plants when ill that can cure them. Okay, so can sick sheep write their own prescriptions? Well, almost, since it seems that sheep can select the correct medicine to treat a specific ailment. They graze and graze until they will finally find a specific medicine which is good and suitable for them. They don't necessarily know what specific plant can cure them, but since they love grazing, they will eventually eat a plant that could cure them. Okay, let's proceed. And so, now we're here at chemical injuries. When we hear chemical injuries, these are injuries to the skin, eyes, mouth, or internal organs caused by contact with a corrosive substance. So when we say corrosive, it is harmful or dangerous substance. Injury by chemical agents. All chemicals, including the therapeutic drugs, are capable of causing injury or even death when animals inhaled, ingested, injected, or absorbed through the skin. Most toxic are poisons, which may occur accidentally when animals ingest poisonous substances. So, we have here basic principles of chemical injuries. We need to understand these principles for us to deeper understand this topic. So, first we have here dose. Small doses may cause serious problems over a long period. So, can we differentiate dose from dosage? So, dosage is the accurate and proper way of giving medicines in prescribed doses. So it means that dose is just under dosage, and dose is the exact amount of medicine to be given or taken by the patient at one time or at stated intervals. And next we have here requirement for metabolic conversion. Third, sites of absorption, accumulation, or excretion. Fourth, individual variation. An important factor that determines the rate of drug metabolism is inherited polymorphisms in enzymes that metabolize the drugs. The capacity of the chemical to induce an immune response. Many chemicals are not directly toxic but inflict or may cause injury by inducing or minimizing the immune response. Okay? And next thing we have here the chemical poisons. Okay, so chemical poisons in animals may either inorganic or organic substances. Inorganic substances comprise of acids, just like sulfuric acid, bases, potassium hydroxide, and salts, mercury chloride. And next we have organic substances are derived from plants, molds, fungi, bacteria, and from a certain parasitic venomous animals. Okay, so when we say inorganic chemicals, these are usually done in laboratories, and unorganic substances come from toxic or harmful organisms such as poisonous animals and even plants. So we have here kinds of chemical poisons. These are corrosives, organ poisons, nerve poisons, and of course poisons affecting the blood. Okay, so corrosives. Acid or alkaline corrosives produce significant local tissue injury that can result in full thickness burns of skin, cornea, the mucosa of the oral cavity, esophagus, and the stomach, just like what is presented on the picture. As you can see, the picture on the left, the dog is burned, and the right picture tells that the mucosa is affected. Okay, so corrosives can burn and destroy body tissues on contact. The stronger or more concentrated the corrosive material is, and the longer it touches the body, the worse the injuries will be. Some corrosives are toxic and can cause other animal health problems. Next, organ poisons. Organ poisons produce degenerative changes in the organs, mainly liver, kidneys, and heart. Okay, example of these are phosphorus, arsenic, lead, mercury chloride, and silver nitrate. Okay, so organ poisons literally damage the internal organs, which may later on lead to a disease and even death. Next thing we have here, nerve poisons. Others overstimulate, depress, or paralyze nerve cells. Some of these act as a nerve stimulants at first, but later as paralyzers. Among these poisons are the narcotics, strychnine. I don't know how to pronounce that word, but let's say it's strychnine. Yeah, atropine, pilocarpine, physostigmine, the toxins of Clostridium tetani and Clostridium botulinum, and of course, snake venoms. The toxins affect both somatic and autonomic nervous systems, and the excessive excitability leads to repetitive firing in axons and axonal terminals, repetitive firing at motor end plates, and an excessive discharge of neurotransmitters in all components of the peripheral nervous system. Okay, next thing we have here poisons affecting the blood. Prevent red blood cells from carrying oxygen either by forming a stable compound with hemoglobin or by inducing hemolysis. Okay, it leads to the cell destruction, which is hemolysis, or by inhibiting coagulation of the blood, or by causing agglutination of erythrocytes, hemagglutinin. Carbon monoxide is an example of a poison that combines with hemoglobin. Okay, so that's well explained. So let's proceed. Occurrence of poisoning. Livestock are exposed to the risk of various toxic chemicals used in mass treatment of animals for parasites. To toxic freshwater algae from drinking water of certain lakes, to alkaloids, glucosides, and saponins from eating poisonous plants, to hydrocyanic acid from eating sorghums during certain seasons, to lead or arsenic from drinking various tips and insect sprays, and from nitrate or chlorate or sodium or calcium from eating fertilizers or seed killers. Well, basically, animals get poisons from their surroundings. Example of this is the insecticides. Insecticides are used to kill the parasite present in the animals, but these insecticides may also cause harmful effects on the animals, right? Okay. So we have here three kinds of occurrence: lead poisoning, insecticides, and poisonous plants. We have here lead poisoning. Lead is highly toxic to livestock, particularly cattle and sheep, and can result to sudden death. Lead is absorbed through gastrointestinal tract. Common on-farm lead sources are lead batteries, painted surfaces, paint tins, some oil grease, and oil filters. Often the first sign of lead poisoning is finding dead animals. When affected animals are observed, they show signs of central nervous system damage. They may cease grazing or stop grazing, appear dull and unresponsive, walk aimlessly, or be blind. Exposure to high amounts of lead can cause gastrointestinal symptoms, severely damage the brain and kidneys later on, and may cause reproductive effects. Large doses of some lead compounds have caused cancer in lab animals, and it lead in total suspended particles may exceed this level. Okay, so subacute lead poisoning, usually seen in sheep or older cattle, is characterized by anorexia, rumen stasis, colic, dullness, and transient constipation, frequently followed by diarrhea, blindness, head pressing, bruxism, hyperesthesia, and incoordination. Okay, so what is seen in the picture, the linings of the gastrointestinal tract is really that damaged. And lead batteries are the most common cause of lead poisoning and residues in livestock. Okay, so let's proceed. Insecticides are harmful to animals and birds. Chlorinated hydrocarbons and organophosphorus compound are two broad classes that are very resistant to degradation in the environment, which are persist in soil and water contaminate in all levels of the food chain. So we have here two kinds of it: chlorinated hydrocarbons and organophosphorus compound. So chlorinated hydrocarbons affect the central nervous system and may induce depression, paralysis, coma, and death. Chlorinated hydrocarbons are neurotoxicants actually and can cause acute effects by interfering with the transmission of nerve impulses. Next thing we have here, organophosphorus compound, are basically the inhibitors of acetylcholinesterase. Thus, acetylcholine accumulates at synaptic junctions, induces twitching, flaccid paralysis, cardiac arrhythmias, respiratory depression, and death. Okay, so organophosphates are derivatives of phosphoric or phosphonic acids. These have replaced the banned organochlorine compounds and are a major cause of animal poisoning. They vary greatly in toxicity, residue levels, and excretion. There is no evidence to suggest that the organophosphate exposure affects animals' reproduction or development. Most organophosphates do not cause reproductive or developmental problems in animals, but some cause lower birth weights or more death in newborn animals. Okay, so let's proceed. Poisonous plant. Plants that contain alkaloids, glycosides, or glucosides, organic acids, minerals like nitrates, selenium, molybdenum, resins or resinoids, phytotoxins, and substances causing photosensitization or porphyrins. Poisons from industrial plants include fluorine or fluorosis. So how do poisonous plants affect animals exactly? Gastrointestinal is being affected, range from local irritation to emesis or diarrhea. Cardiac glycosides in plants may cause nausea, vomiting, and cardiac arrhythmias in animals and humans. Poison usually takes place through ingestion. Okay. So again, there's a simple commercial right here, and a domestic cat can outrun Usain Bolt. So we all know who Usain Bolt is. Well, he is the fastest runner in this world, and so Bolt's record-setting runs probably place him around 30th on the list of the fastest Okay, among all any other species or animals, Bolt is the 30th. Okay, fastest among all any other organisms or animals, behind the white-tailed deer, warthog, grizzly bear, and house cat, which can hit speeds of about 30 mph or meter per hour. Okay, next thing. We have here poisonous plant rock fern. Poisoning is capable in causing significant disease in both sheep and cattle. These ferns have been associated with Dumaine syndrome. So this is poisoning. This poisoning is an acute form of poisoning which causes extensive hemorrhage. A more chronic syndrome also exists where carcinogenic effects of the toxin cause benign or malignant tumors of the urinary bladder, also known as bovine and zootic hematuria. Well, as you can see in the picture, this fern is actually have the same structure with other ferns, so they cannot easily identify what kind of plant that is. Okay, this is a picture of it, and it also affects the gastrointestinal tract. Okay, and so we have here again, rabbits have 360 degrees panoramic vision, allowing them to detect predators from all directions. So how is it possible? The field of vision is the total angle of view where objects can be perceived. In the human, this angle is about 180 degrees. The rabbit, with his unusually large protruding eyes located high on the sides of his head, has a field of vision almost 360 degrees, and he can see well above his head too. This allows him to see danger coming from just about any direction without moving his head. Due to the placement of his eyes, a rabbit ends up with a small blind spot of about 10 degrees directly in front of his nose and below his chin. This explains his inability to find immediately to treat you have a place there. Okay, so that's all about our topic, and I hope you understand some of our discussions, and have a nice day ahead. Thank you.